Hello, my name is Brendan Williams, and I'm a pediatric orthopedic surgeon specializing in sports medicine. On behalf of the Pediatric Orthopedic Society of North America's Sports Quality, Safety, Value Initiative, today I'll be presenting Strides to Safety, Tips for Running Injury Prevention. I'll first provide an overview of running injuries, discuss some risk factors for injuries, and provide you some tips for prevention. And finally, I'll let you know when it's time to see a medical professional if you get injured. Running is a wonderful form of exercise that anyone can do. You can run anywhere, anytime, without the need for expensive equipment. 10 to 20% of Americans run regularly, including people of all different ages. Running has positive effects on mental, physical, and cardiovascular health. Although running is a great form of exercise, injuries among regular runners are common. Injuries can also recur if not appropriately treated. Therefore, prevention of injuries in the first place is crucial for young runners. Running injuries can occur throughout the entire body, but are most common in the lower extremities, particularly the hip, knee, lower leg, foot, and ankle. Injuries can be acute or sudden in onset, like sprains, strains, or dislocations, or result from overuse due to chronic repetitive stress on certain parts of your body. Muscle strains are a common acute injury, often due to overly forceful contractions, sometimes from sprinting without appropriate warm-up. They cause muscular tenderness, swelling, and pain, and are worse when the affected muscle is stretched. Calf and hamstring strains are common in runners. Stress fractures, sometimes called bone stress injuries, are caused by repetitive loading on the bones and joints. They are often due to insufficient rest or inadequate nutrition. Symptoms include pain with weight bearing, swelling, and tenderness. Stress fractures commonly occur in the hip, shin, and foot. Tendons attach our muscles to our bones. In children, tendons attach to growth plates near our joints. Repetitive stress can cause inflammation at the insertion site, resulting in tendinitis, tendon inflammation in adults, or apophysitis, growth plate inflammation in growing kids. This results in swelling, tenderness, and pain with movement of the involved joint. Runners frequently experience this around the kneecap and near the heel. Anyone can get injured while running, but injuries are more frequent in older patients, males, and those who are significantly overweight or underweight. Patients who have had prior injuries are also at increased risk of re-injury. Certain anatomic differences can increase the risk of injury, like a high arched foot or cavus foot, increased running intensity and mileage, and hard running surfaces also increase the likelihood for injury. So what can you do? Well, there are numerous ways to help prevent injuries while running, including warm-up and stretching, checking your shoe wear, optimizing your running form, and improving your training regimen. Appropriate warm-ups and stretching is important to prepare your body for running. Static stretching is most common, but passive stretching and dynamic stretching can help improve your flexibility and reduce your risk of injury. Ballistic stretching pushes your joints and muscles to the extreme, which can be helpful for some types of athletes, but this is best introduced under guidance of a coach, athletic trainer, or physical therapist. Focusing on proper running form can both improve performance and reduce the risk of injury. Maintain an upright posture and look forward. Relax the hands and shoulders during arm swing. Avoid bouncing and pounding when your feet hit the ground, and assure a good cadence to avoid overstriding. Your coaches, athletic trainers, and physical therapists can be helpful in observing and correcting improper form that may contribute to injury. A lot of helpful online resources are also available. Improper shoe wear can contribute to injury. Assure your shoes are meant for running and match your running style to provide adequate support in the right areas. Proper training is important as well. Increase your mileage and speed gradually. Vary your workouts and the surfaces you run on, and assure you train adequately before you compete. At the end of the day, you need to listen to your body and when it tells you that you need a break. Cross-training is a great way to mix up your training regimen. Choose an aerobic activity that increases your heart rate, like running, and incorporates many muscle groups. You can change the terrain or environment, like running in a pool, or simply do resistance training, elliptical, biking, or swimming. Good nutrition is key to your running performance. Eat a well-balanced diet with lots of fruits and vegetables and complex carbohydrates like whole grains and beans. And be sure to get sufficient protein intake as well after your workouts. Some dietary preferences result in missing out on adequate nutrients that are important for a healthy musculoskeletal system and injury prevention. If you have concerns or are getting injured frequently, you may want to speak with your pediatrician or a nutrition expert to see if supplementation of these nutrients is necessary. At the end of the day, rest is critical. Good sleep hygiene helps your recovery. And be sure to have adequate breaks between workouts and between seasons. Try to build in 1 to 2 off days per week and a month or two each year. Many minor aches and pains can be monitored at home or prevented altogether with the tips provided. However, medical attention is sometimes required. You should see a health provider if you experience a painful pop or snap during an injury, if you're unable to put weight on your arm or your leg, if you have significant swelling that does not resolve with rest and ice, if you are unable to move the injured area, or if your pain does not improve after rest. Sorry, I've got to run, but thanks for your attention. Here are a few helpful resources about running and injury prevention if you wish to read more. Orthokids.org is a great place to start for any information about orthopedic issues affecting your kids. Have a great day.